I'm here to ask for your help. My grandpa recently passed away from Alzheimer's disease. I can tell you firsthand that his disease was devastating financially, emotionally, and mentally to my grandpa as well as his caregivers. 111th Congress passed a public law named the National Alzheimer's Project Act in January of 2011 that is designed to implement a strategic and integrated national plan to overcome Alzheimer's disease. I'm hopeful that this act will make progress in the fight against Alzheimer's. However, I have some important recommendations for changes in the bill. Alzheimer's disease can be explained as a disorder that deteriorates brain cells over time. The disease is the leading cause of dementia, a condition that involves gradual memory loss, a decline in the ability to perform routine tasks, disorientation, difficulty in learning, loss of language skills, impairment of judgment, and personality changes. As the disease progresses, people with Alzheimer's disease become unable to care for. A devastating 1 in 8 people over the age of 65 suffer from Alzheimer's disease. This doesn't even take into account the 15 million unpaid caregivers that are affected by the disorder every day. Medical costs for Alzheimer's are skyrocketing. In 2011, associated costs were up to $183 billion, which could potentially bankrupt the entire healthcare system. Alzheimer's disease is currently the 6th leading cause of death in the United States. However, it's the only cause among the top 10 without a way to prevent, cure or slow its progression. That's crazy, isn't it? Alzheimer's already kills more people than diabetes alone and more people than breast cancer and prostate cancer combined. The beginning structural steps were taken by the 111th Congress on January 4, 2011 to jumpstart the fight against Alzheimer's. The Senate and House passed the National Alzheimer's Project Act (NAPA) with hopes to create a strategic and integrated national plan to overcome Alzheimer's. I suggest a stronger care and support system implemented in the National Alzheimer's Project Act for the benefit of Alzheimer's patients as well as caregivers. The main purposes of the Act according to the Alzheimer's from the Frontlines 2011 report include but are not limited to 1. An annually updated national plan submitted to Congress on how to overcome Alzheimer's. 2. Annual recommendations for priority actions to both improve health outcomes for individuals with Alzheimer's and to lower costs for families and government programs. 3. An annual evaluation of all federally funded efforts in Alzheimer's research, care and services, as well as their outcomes. And 4. The creation of an advisory council on Alzheimer's research, care and service. However, the components of NAPA alone are not enough to make a drastic effect on this growing epidemic. We need an aggressive care system effective immediately. We need an increased public awareness of the disease and testing for early onset. We need a massive increase in support for caregivers. The bottom line here is that the U.S. needs less planning and more executing. The current public awareness of Alzheimer's disease is weak at best. NAPA should account for a public awareness campaign that focuses on spreading knowledge about warning signs and early detection screening. The financial aspect of NAPA is not adequate for the amount of research and funding necessary for scientists and doctors to make significant progress on finding a cure. The 2011 report from the Alzheimer's Association states, the National Alzheimer's Project Act does not currently recognize Alzheimer's as an unmet medical need within the context of the Food and Drug Administration's accelerated drug review processes, and it should correct any barriers that discourage the aggressive pursuit of preventive and other pre-symptomatic treatments. There should be at least a $2 billion investment fund available for research according to qualified scientists. Another potential failure of NAPA could root from the lack of care coordination. Medical professionals need to focus on recording diagnosis as early as possible, and coordinating Alzheimer's care with the patient's other medical issues. This would result in a decrease in preventable hospitalizations and better care coordination. NAPA also lacks a substantial driving force of money for state/federal governments as well as American families that are not equipped to keep Alzheimer's patients at home for the maximum amount of time. The bill needs to direct funds toward cost-effective custodial care services so that patients don't wipe out their savings and end up relying on Medicaid. The National Alzheimer's Project Act of January 2011 has the potential to provide the breakthrough research and care that America needs today. However, it's going to take an extreme amount of time, execution and funding. A widespread public awareness campaign needs to be added to the bill, as well as complex plan for care coordination of patients. Early detection screening needs to be better advertised and recorded by doctors. Alzheimer's should be legally recognized as an unmet medical need of our nation in order to prevent barriers from blocking progress. Funds from NAPA should be allocated to federal and state governments to implement programs that allow patients to remain at home for the longest amount of time, which will reduce the medical costs of hospitalizations from Alzheimer's. Congress made a great leap forward with the passing of the National Alzheimer's Project Act, however the process is just beginning now. Actions of this plan need to be tweaked first, and then aggressively implemented. Time is of the essence. Consider this: another person is diagnosed with Alzheimer's every 69 seconds.